I decided to write this book because I've been involved in healthcare reform since 1988 when I lived in Vancouver, Canada, and worked at the Fraser Institute. So I've, been pushing for market-based reforms and explaining to the American people after I moved here in 1991 why a complete government takeover of our healthcare system, i.e., Medicare for all, single payer, would be disastrous for all of us as patients and for doctors. So I want to empower doctors and patients. So that's how I sort of got into this, and I'm completely passionate about saving our healthcare system, as Wayne knows, and he is too. And so back, in April of 2020, COVID, the pandemic started. And by December of 2020, through Operation Warp Speed and Pfizer and Moderna, about 70% of people around the world had received their first vaccination. And the pharmaceutical industry seemed to be like everyone was loving the pharmaceutical industry. But, by August 2022, things had changed. People were becoming skeptical of big pharma, as they call it. And so in August of 2022, then President Joe Biden signed into law the Inflation Reduction Act, a major part of it, of course, being price controls on Medicare Part D and B drugs, starting with the first price controls on 10 drugs in January of 2026. And then 15 drugs have just been named for Part D, January 2027. So I'm very upset about this because I've seen what price controls have done to research and development in Europe in particular, and how that all ended by 2004 because of price controls, and because of Canada, how there's always a shortage of drugs, and many of the drugs that we have here in America aren't even on the formularies in Canada. So I have too much time on my hands, I guess. So I had to write a book.